At a time when long-term care facilities are sealed off to the world for the safety of those we serve, but on full display in the media for the heartbreaking coronavirus outbreaks that have resulted, in part, from the consequences of chronic underfunding and lack of recognition as a critical component of the national healthcare delivery system, we are grateful to be able to tell you our version of this story. A story that is not without challenge, but that is transparent, honest, and compassionate. A story that celebrates the competence, preparedness, and ingenuity of the heroes of long-term care. A story that demonstrates that effective pandemic management and economic outcomes are inextricably intertwined in the world of aging services, and that it truly takes a village to keep our residents, patients, and staff safe. A story that is representative of both the frustration and the achievement of organizations like ours nationwide.
In the skilled nursing side, we take a minimum of 124 temperatures a day, and if anything shows abnormal, we would increase that to every shift.
For the manor and for the villa, we're checking 111 daily, and same thing that we may have to do rechecks on those and increase that monitoring.
We've had about, I'd say close to 700 to 800 fabric masks donated. We were able to, have a good supply then to be able to rotate.
Thank God for the volunteers and the donations that we've received in the form of cloth masks or gowns, gloves, you name it. It's just unbelievable the quantity that we've doubled and triple used over the last 3 or 4 weeks.
We, on a regular basis, screen 375 staff every day and 243 residents. That's a total of 618 screens that we do. We think about how many probe covers we use, how many masks we use. That is a crazy number, 618 a day. That's 4,326 a week and 17,304 in a month, in the first month that we did that. Over 17,000 screens.
We are not operating under ideal circumstances by any means. We had a very robust emergency preparedness plan, but nothing could prepare us for having to tell families that they aren't able to come here and see their loved ones. That has been a heartbreak.
I can't imagine how difficult it is on your end of things, not seeing your loved ones.
We're just making sure that we take care of them as we would our own family members.
Your family members are like our family members here. We take all the procedures that we can to keep them safe, strong, and healthy through this whole pandemic.
We know that you love them, and we're reminding them of that constantly.
It's gonna be a long journey, but we're getting through it one day at a time.
In my 25 years as a nurse, I remember swine flu. I remember Ebola not that long ago coming through, but neither of those really stuck. They never really seemed to hit home or to have a lot to do with the organization that I was with at the time. And then, I remember hearing Wuhan, and I remember hearing coronavirus, and I know coronavirus. As an infection preventionist, there's multiple coronaviruses around that cause things like the everyday common cold. But why were they making such a big deal about this thing in Wuhan?
As part of a new regulation set forth from the CMS in 2017, as an organization, as a long-term care facility, we were asked to really revisit our emergency preparedness plan. Our emergency preparedness plan really is summarized in this big binder. This really is a skeleton, an outline, if you will, of what we felt we would do in the event of any type of emergency.
Very shortly, Sondra, our president and CEO, came forward and said, we need to initiate incident command. This is going to be a problem. From there on in, everything just happened and changed so fast. So I remember Sondra sitting in front of us adamantly saying, we will not let this in our building. We will not let this in. And I thought to myself, what the heck do you do with that? I don't even know how you would start to. I can't keep out the common cold. I can't keep out the norovirus. And the more that we heard about how detrimental and how harmful and how lethal this could be to especially the people that we take care of here at St. Paul, it just got kind of scary.
At our daily incident command meeting, we have an agenda where we talk first about the regional illness activity in our area, which informs everything else that we do. We then review any new policy or guidance from CMS or the CDC or the Department of Health Services. We then talk about internal surveillance, so infection control surveillance, looking at any symptoms that are being reported by staff or residents of any of our facilities. We talk about our supplies and our inventory of personal protective equipment so that we know exactly how many days we have of those important materials. We talk about our survey readiness if state surveyors were to walk in and take a look at our infection control procedures.
As a skilled nursing facility, each year we go through a survey, and that survey is a recertification process for our Medicare and Medicaid services. The survey typically lasts about a week, and they go through an in-depth review of our systems. So this year on March 16, 2020, our surveyors had entered the building to complete our recertification survey. And about halfway through day one, they were actually notified that the recertification surveys were having a temporary suspension due to COVID-19 and to focus on COVID-19 infection control. When we received the memorandum which explained to us the temporary suspension of the recertification survey, it also included a new targeted infection control survey. We have taken that self-assessment and we have broken it up into an audit form. So each week our clinical leadership team is completing audits to ensure compliance.
We have been constantly thinking about what comes next. Restricting visitors, to universal masking of our staff, to making sure that we have N95 masks fit tested for our staff, to having options for providing for negative pressure in our resident care areas.
Our mission continues to be quite alive here at St. Paul Elder Services. I think we've shifted a bit from the focus of enriching the life experience to truly, right now, protecting and saving the lives of those people that we serve.
COVID-19 has affected the manor maybe a little bit differently than it has other areas of St. Paul's because our residents are living with dementia, so they're not always able to identify changes that have happened or why they're happening or why everyone is walking around with masks on all day. But they are able to identify and can recall that they haven't seen their families. One really positive thing that has come out of this pandemic is our use of the virtual visits, the iPads to FaceTime or to Skype with family members. The residents are really encouraged after having those visits, and actually last week one of the residents, after talking to her daughter, said that now she feels like she could go clean her room because she was just so happy being able to have that connection.
Jean has been here now for, I'm going to say, for about the last 8 years. They brought me into the villa here, and I've been here now since, I think it's June of last year sometime. I tried to get over there every day before this pandemic took over. Sometimes she would really come out with something, and she would look at me and she says, "Who are you?" And I would tell her, she says, "Oh, you're my Bobby." Yeah, I said, "Yeah," you know. And then a couple of times she took my hand and put it on her cheek, and she said, "Bob, I love you." And I thought, oh, that was really treasure. That was really wonderful. I'll treasure those times. Now, of course, we're quarantined. I haven't seen her now for 3 weeks, but I did get a chance to talk to her once on the activities iPad when she was in a real good mood. I could tell she recognized my voice because I would say, "Hi, Jeannie," and she'd look around and say, "Bobby, who are you?"
We have to be very creative in how we perform our engagements because we're so limited on what we can do. We can't have group engagements larger than just small groups, really. Bingos we try. Everyone has to be 6 feet apart. We are doing happy hour once a week instead of, group happy hour. It's traveling happy hour. We go door to door, but we still get their favorite drinks.
Well, I do knitting, crocheting, reading. But you've been talking with your family.
Yes, I've been so fortunate in having my family on TV where I can just sit right there and visit with them. And I've done it twice now, and we're going to do it some more.
Well, they've been exceptionally wonderful, I think.
The staff?
Staff, she said, right.
Oh. They're so pleasant about bringing our food to us every day.
Our routine as staff has changed dramatically. We don't have a dining room anymore, so we had to switch our dining room staff into help load cards. There's been a lot of confusion, but we're working through it, and we're finally finding our routine now.
And if you look in the students' eyes, you can see that joy that they're still serving, and that's what we're all called to do. I mean, it's really that simple. We're all called to serve.
Right now, we're trying to be the family that can't come in to our facility right now, to be the family that they need. I think one of the biggest hurdles that we've had to try and overcome in the assisted living setting is that the family members really provide a lot of support, not only emotionally but physically as well, whether it's laundry or maybe help with showers, and really trying to provide all that extra assistance for all of our tenants. That's been one of the biggest hurdles that we've had to try and overcome.
We want you to know that if your loved ones are afraid or anxious or confused or maybe have experienced a loss, we are spending that individual time with them, just providing reassurance and a listening ear. We've also proactively had conversations with our residents and our families to ensure that should they become infected with the virus or become ill, that we respect their choices regarding what treatment they would want based on their personal values and beliefs.
Spiritual care is very important here. And so we try to remind them of God's love and God's goodness and grace. It's been hard for people not to come to the chapel for Mass. Our small group of priests say a quiet Mass. Many are watching it on TV.
I'm extremely grateful for the opportunity. I see the empty chairs there, but I see people who live here at St. Paul's, and I see them there.
I'm a hospice nurse for St. Paul, and one of the hardest things for me right now is that families can't visit their loved ones on hospice. That's really difficult because I'm calling people and telling them that their loved one's condition is getting worse and declining, but their family can't come and be with them until those final days. I think it's hard to deliver that news, and you can't comfort that person, or they're not here for you to give them a hug. Or even when our patients pass away, we can't have the staff gather for the departure ceremony, and those are so meaningful to families.
This is just a big experience in itself. It's like we're in the twilight zone, that this is just not real. The positives are my fellow associates have just really come together.
Well, it is a little different now with wearing the mask and first of all coming in and getting our temperature and answering all the questions, but still trying to do the same thing when we transport individuals, make them happy. Right now I'm helping out at the front desk in the morning and at noon. We're delivering plants or food or whatever people are bringing in for individuals.
Working on core unit, pretty much everything. Treatment with our patients, coming them, bringing them into the gym, making sure they're staying 6 feet apart, having them masked, having us therapists masked, and just kind of keeping our distance and making sure we still get a good treatment with our patients.
We try, even you can smile with a mask on, you can tell in your eyes you're smiling. So we're gonna keep up those smiles, and our residents can see that.
I wake up with a smile on my face, and I think I basically go to bed with a smile on my face. I mean, I love life, and thank God so much for what I do have and that I'm able to still work at my age.
Before COVID-19, I spent a lot of time working on videos, which usually meant I was behind a camera or behind the computer screen editing. Being in the manor, helping out with keeping the residents engaged and entertained and just visiting with them has really changed my life. In fact, it's changed my life so much that I'm going to be taking a CNA course. It's amazing how even in something terrible like COVID-19, blessings are still abounding. God is still working.
I was watching TV and they were having the signs and posters up for the nurses and doctors that were going into the hospitals. And we have such heroes working here at St. Paul's that I thought we should do something for them. And what we did is told them how much we appreciate them, that they're wonderful. And there's so many things that we could do for ourselves before that we can't do now. And they truly are heroes.
Our staff have been here, they have been showing up, they have stayed positive, they have filled in as family to our residents and patients in the absence of actual family members being able to be here.
You know, our staff have been great. We had to rely on them being stewards of resources during this time and being creative with how we manage those resources.
It's been an honor to lead this team that has stepped up and said, whatever we can do, we will do. St. Paul Elder Services is the second largest employer in the city of Kaukauna. Many long-term care facilities in rural and small suburban areas are the largest employers in their communities. We are an economic force. If this virus takes the lives of a significant portion of the demographic we serve, countless providers simply will not survive, or will not come out of this the same organizations as before this crisis. Long-term care providers need to be prioritized for the resources that we need to survive this. We are in a desperate moment.
One thing I'd like to remind us all, keep our eyes on Jesus. We are walking together in this.
The city leadership in Kaukauna has been wonderful as well. They have been involved in some of our incident command meetings. The fire department graciously borrowed their fit test kit to us so that we could properly fit test our staff with N95 masks. The police department and the mayor have been supportive in terms of some of the communication and messaging that we've had to put out there. And the community has obviously wrapped us in their love and prayer, from social media posts to cards that people are sending us. We know that we are being lifted up in support and prayer at this time by the community, and we say, keep it coming. It's working. Keep it coming.
It's just been a pretty life-changing experience. I don't think it's over yet. It's not something that any of us will ever forget, except the feeling that's in your heart when you consistently hold that strong fort to keep those that we take care of, keep them healthy and keep them safe.